Welcome to Retina Health for Life from the President's Corner, brought to you by the American Society of Retina Specialists. I'm your host, Dr. Tim Murray, coming to you from Miami. On each episode, we'll bring you inspiring conversations about your sight and the special role the retina plays in making healthy vision possible. We'll hear from expert retina specialists as well as directly from patients about living life to the fullest with retinal disease. Join us and learn how to safeguard your retina health for life. Welcome to the American Society of Retina Specialists Retina Health for Life from the President's Corner. 11 million people in the United States have age-related macular degeneration, known as AMD. The number is expected to double by the year 2050. If you or a loved one has been diagnosed with AMD, you likely have many questions and concerns about this often life-changing diagnosis. In addition to speaking with your retina specialist about your age-related macular degeneration diagnosis, there are many wonderful support organizations out there for people with AMD. One of those organizations is going to be discussed tonight by its Chief Medical Officer, Dr. Joshua Malley. So Dr. Malley, your organization, Macular Degeneration Association, has been a nonprofit focused on patient education and improving care for patients with macular degeneration. Can you tell me and our audience what really brought you to begin to join in sort of that type of an outreach program?
Sure. Thanks, Tim. Thanks for having me. And I'd like to thank the ASRS for having me on the podcast. And for me, coming out of training, I did my residency in Albany, New York, as well as my Retina Fellowship, Retinal Fellowship in Albany as well. And I really, was really excited to come out and practice. And I moved down to Sarasota, Florida, where I currently practice in private practice in a multi-specialty group. And for me, it was really important to go back to my core about why I got into ophthalmology and did retina for me. And really, it was all about helping patients and helping people. And I really wanted to give back to the community. And I thought, I was presented with a really great opportunity to work with the organization called the Macular Degeneration Association. I joined them in 2015 and subsequently became the Retina Medical Director and have been serving that capacity ever since for almost over 4 years now. So for me, it was just a great opportunity to really give back to patients and focus on things like education, scientific research, and patient advocacy.
So I think that's really key because many of our members in the ASRS really went into this because of the passion to take care of patients with a variety of diseases. And we hate to see our patients do poorly. And it's been a huge shift within our field, I think, over the last 10 years in our ability to treat these patients. But even with the treatments we have, there's often a disconnect between what you as the physician would like for your patient and what the patient would like. So from your perspective, from the association, what do you think are your most utilized services? What do patients take the most advantage of through the Macular Degeneration Association?
Yeah, in our organization, we call it MDA for short. Certainly we strive, as I mentioned, three important areas: education, research, and patient advocacy. In regards to patient education, I think that one of the most important services that we provide is actually educational seminars, where we used to actually do it in person, obviously, in the last year and a half or so. Because of COVID, we've actually gone to a more virtual format. But before COVID, we're hoping to restart when it's safe to do so, we would have large seminars in many cities across the country where we used to make them free events for the public to come and learn about macular degeneration, learn about new treatments, in a very relaxed atmosphere where myself would be a speaker, and we had other speakers as well from our medical board and so forth that would come and give a lot of didactic lectures geared towards patients, caregivers, anybody interested in the disease state. Because what I found was actually, as you know, Tim, we're really busy in the office, right? We're seeing more and more patients. As much as we would love to spend time with them and answer all the questions that we can, sometimes, there's just too many patients in the day, not enough time, and we just can't. We're unable to answer all the questions, and I think that's where there's a really unmet need, is that educational aspect, and that's where we hope these seminars will help to answer questions that weren't answered in the doctor's office. The other thing is we'd like to support any sort of research endeavors in AMD, whether that's supporting individual research or making sure that the public is aware of various research initiatives that are out there, just disseminating information basically about new treatments and so forth. So we try to help with that aspect. And finally, patient advocacy. So one big thing that we've started actually in the last 2 years is an initiative called the MDA AMD Centers of Excellence. So these are we have a certain criteria that was designed by our medical board, and we review applying programs, and we approve programs based, and when I say programming practices, basically that meet certain criteria that we know that are going to meet a certain standard in helping patients with macular degeneration and their families. So, for example, we ensure that the practices have all the medications available to them to treat AMD, wet AMD, making sure they have things like OCT and fluorescein angiography capability, just kind of basic criteria that standard practices will meet, but that are good practices that we know that patients can actually look up in a database to see which one is close to their area, so that way they feel comfortable that they know these practices that have been vetted, and we've designated them as AMD Centers of Excellence. So we try to keep those things for patients, and finally, all this is kind of on our website, www.macularhope.org, where we have a very robust website where we have a lot of patient resources, such as a blog, quarterly newsletter, videos on tips, for different eye diseases and so forth. So a really broad range. We try to give a really broad range of resources for patients to help them get them through AMD and learn more about it.
So Josh, some interesting initiatives. One of the things that we try to do is to encourage our patients to understand who should be taking care of them. So you've looked to vet programs. We have really focused on members of the ASRS, so that if a retina specialist is a member of the American Society of Retina Specialists, they have really met some significant personal criteria. And as far as I'm aware, within a retina specialty group, it's incredibly rare not to have the equipment or the tool set to be able to take care of those patients. Our major concern, actually, from a societal perspective, is patients that are in practices maybe where they're being taken care of, where a retina specialist is not the person that manages them. So it's interesting that you're thinking to go at it by looking at centers. We've really been more focused at looking at the qualifications of the doctors. And it's so hard to find a good doctor. I think our patients and their families have that difficulty. I think sometimes even physicians outside of their own specialty practice can have some difficulty with that. So we've been a big push to look at really focused opportunities for people to know what minimum standards are. So I like that concept. But for us, the concept is, for me, it always comes down to who the doctor is that's taking care of you, more so than the institution or the site. And I'll tell you, I think you're absolutely on the money about sort of those interpersonal one-on-one discussions. There's some great information out there, and it's just hard to really convey that sometimes to the patients. So there's fact sheets at the Foundation for the ASRS. You and I both, I think, use the National Eye Institute and the National Institute of Health. And then there are some excellent programs through Fight for Sight and Research to Prevent Blindness. Having said that, I still don't feel like we make the same connection that you and I want to have with our patients. I think both of us believe the more knowledgeable your patient is, the more vested they are in their care, the better that they do. So very interesting approaches. How do you counsel your patients when you're seeing them? I find it's kind of interesting, I'm sure for you too. We take care of our patients for such long periods of time now that I find my patients getting very knowledgeable over time, they'll come in and want to look at the OCT to interpret their own OCT. They want to know what the level of acuity was, what their intraocular pressure was. Do you see that also?
Absolutely, Tim. I mean, I think the level of sophistication is really impressive as we move along here. It's certainly, I agree, patients all the time ask about their OCT, are more knowledgeable about new treatments, new medical devices, new data coming out. I mean, certainly it does depend on, there's different patients, different generations, but I would say that I completely agree with you. I think that's kind of, that's why it's even more important for us to really provide that baseline education, not only for those patients that are asking the questions, but I think there's also a value to providing that education as a baseline, so that every patient has a baseline knowledge about the disease state. And I think that helps not only for the patient to understand that, but also helps compliance, because then they understand why it's important they're coming in for the injection visits, why it's not a good idea to take off a month longer than you should on your injection visits and so forth, because they have that kind of at least that basic understanding of the disease state. And I think that inherently gives them that sense of the need for compliance and for coming in for appointments and following the instructions of the physician and so forth. I think all that kind of ties together into that basic understanding of the disease, the major risk factors, the prognosis and what to expect, and also not only that, the patient itself, but also the caregiver, and making sure they're involved, whether that's a family member or a friend or a neighbor, making sure that they're also involved in that too. And that's why I think it's just so important to have that educational component involved. We try to help provide as a supplement. Obviously, nothing takes the place of a doctor's visit and talking with the patient one-on-one, but certainly we at MDA feel that we can provide a helpful adjunct to patients outside the clinic, where maybe they want to just ask some questions that they didn't have time to ask, things like that. And that's kind of where we hope to bring some value to patients and caregivers, because I know sometimes it's tough. Sometimes you forget to ask questions, you write them down, patients write them down, things like that. But they just, it's nice to be in a relaxed forum where you have a lecturer kind of talking about the disease state, but also providing question and answers for them as well. So
yeah, I think that's so critical, and I'll tell you where we really, at least in my practice, appreciated that is that many practices didn't allow caregivers to accompany their patients to the exam or the treatment. And we very early on recognized that wasn't a good option for our patients. There was a very significant difference in the understanding just by having another family member or a caregiver with you in the room. And it's interesting to have another set of ears. So I love that. And I would suggest for people that do, when you guys get back to having your in-person meetings, always good to have somebody with you that's listening with you. We sometimes hear so differently. The same information is processed so differently. So I've really felt how important it is to have patients with their caregiver or their family in the room when we're talking.
Absolutely agree. And I think our programs are now, again, not only geared to the patient, but also the caregiver. Because a lot of burdens, as you know, a lot of burden is on them, with certain wet AMD patients, if they're not able to drive or things like that. I mean, it's tough if they're on monthly visits or, 8-week visits, things like that. Some of these, the caregivers, they have either work or they have other responsibilities, and they're in this with their loved one, and it's certainly a team effort and certainly a battle. And I think it's important to have them involved and have their questions answered and understand why it's important to bring grandma to the clinic, or grandpa, or their parents or whoever it may be. But I think that's just so important, and it helps to keep that patient and the caregiver motivated to continue to maintain that compliance and maintain the best possible visual outcome.
So we've also been very focused on saying that macular degeneration is not your grandparents' macular degeneration. There have been such huge advances over the last decade. And I love the fact that part of what your organization does is push out the new research and new information broadly. It's a very exciting month for us as we enter into the AMD month. Could you touch on what you think two of the major advances are for the patients that we take care of every day, and what that means for the patients in your mind?
Sure. I think the first thing is the durability aspect. As you know, the FDA just recently approved the medical device Susvimo for wet macular degeneration, which will be a nice medical device we can implant in patients to provide potentially 6-month refills, which I think would be a tremendous advancement in our field. And also just the recent FDA approval just this past weekend of Vabysmo, which is a potential 16-week dosing agent with the combination Ang2 and anti-VEGF properties. So really, really exciting from a therapeutic standpoint with these two approvals recently. I think that'll make decrease the injection burden that we have on patients and hopefully increase satisfaction while giving us very robust visual gains. And I think the second major development is hopefully on the monitoring front. There's a device called the 4C Home device that I like for patients with dry AMD to help to monitor patients when they convert from dry to the wet form of AMD, and it finds it very quickly. And that same company is also working on a home OCT, which could be a game changer in regards to how we monitor patients in between intervals and the potential of sort of really refining the way we as retina specialists approach dosing and our injection frequency. So I think there's a lot of excitement, as you mentioned, there's a lot of excitement, a lot of great technology that we have now in our field and upcoming in the near future. And certainly I think we'll be able to manage patients better, make them more satisfied, and give them a lot of hope for the potential in the future.
And I think what we're seeing too is the ability to personalize care for our patients. So, a port delivery system may not be the best option for some patients, and there may be concerns with the port delivery system that are different from concerns with intravitreal injections, so that the art of the medicine with each individual patient becomes really, really interesting. And then the other thing I think you and I have both experienced is that what happens in a clinical trial is sometimes different from what happens for our individual patients. And part, again, of the art of medicine in macular degeneration is taking care of your patient and incorporating sort of best advances, but realizing that every patient is a little bit different. So we've been excited about durability of other agents, and we've had some issues with those, as you're aware. So it's always interesting to me to see how we're going to roll that out to our patients and how we have these discussions sort of in our office. And I think it's key that the patients have the educational knowledge to be able to question back and forth. I think that's part of the art of what you and I do every day.
Yeah, absolutely. I think you nailed it, Tim. I think the interesting thing there was that the fact that again the treatments are very individualized for patients, and I think there's a lot of excitement when something comes out and patients ask, is this for me, and they always think it's for them, and again, if you look at how it is, again, not every treatment's gonna be for every patient, and I think that it can sometimes, provide a kind of roller coaster of emotions for patients. They get really excited, then they get disappointed that maybe they're not a candidate. And I think that's what we try to do is we try to step in. We hopefully try to have educational seminars. We had one recently on Susvimo to help kind of at least answer some general questions about it and make sure that patients know what it's all about and what it's indicated for. Again, each individual patient has their own, basic, characteristics that they may or may not be a candidate for it. But as an example, but certainly I think just giving them initial information that they can hopefully have some kind of baseline information when they go to their doctor, they can have a more informed discussion about potential treatments and things that are actually going to be applied to them. So I think you really nailed there. It's really important. That's why education is so important to help prevent that roller coaster of emotions.
And I think you're correct. I mean, I think what you're really looking for is that information that allows you to ask the questions for you as an individual. And I think the more information you have from the broadest sources possible, really helpful. And then that's one of the reasons we want to make sure that you're speaking to a retina specialist who really has an understanding of the disease and is actively involved in the treatments. But I think the take home for me is, even though it's been a roller coaster for you and I as physicians over the last 10 years, it's been a roller coaster continuously improving the outcomes for our patients. And I think that's the biggest thing to take home for patients now, is that you can have these amazingly good outcomes if you can be active in your care with your doctor. That's the biggest thing I try to emphasize to every one of my patients and their families. How do you do that in your office?
So I think it's so important to do sort of a shared decision making model. I mean, I really like to involve the patient whenever I make decisions. I know some patients just like say, "Hey, doc, whatever you say goes," and I don't want any part. But I do at least like to offer them the opportunity to be involved in their care, to understand what treatment they're getting, what are the advantages, what are the disadvantages, what are the risks and benefits, and making sure that they're on board. I say, this is what I'd recommend medically, but what do you think? And I think that shared decision-making model ensure that the patient understands, what they're getting, what medication they're getting, why they're getting it. And again, it goes back to that same educational point, but I really love the shared decision model because I think, we're all in this together. It's a team approach, everywhere from the front staff, check-in staff, to the technicians, to our scribes, to the doctor, to everybody. I think it's important that we all are involved and that we are involved in patient's care, but also that they feel like they're involved also on the team and they're involved in their decision making.
And one of the things that is unique in a positive and a negative way, of course, is that this is a condition that requires repetitive evaluation and often repetitive treatment. So I think we get to really know our patients very well and they get to know us. And I think that's very helpful. You touched on a few things that I think are key. I love your comment about, write your questions down. I find my patients often, are there in the moment and it's hard to remember what you want to ask. So I find that helpful. I tell them, if you have a concern, I think the biggest thing that I really am passionate about is when somebody's found a piece of information that's negative, like they've gone to Google, that they discuss it with us, because often it's not something applying to them. So I love the fact that you've got an organization with excellent information available to the patients and the caregivers, and the focus on how important a retina specialist is in their care. So we touched a little bit on what most of the patients that I deal with are concerned about, which is that concept of treatment burden, of having to come back over and over and over again. And you touched on two major advances that may help with that. How do you think the future is going to go forward? Do you see other advances allowing us to prolong intervals between treatment and establish better durability for our patients?
Sure. I think, the patients that are going to be listening to this, they certainly love for me to say that there's going to be a cure, which obviously I would hope and I would dream for that. But I think, at least for the foreseeable future, I think we're really looking at better treatments, potentially, things like gene therapy, stem cell therapy for dry AMD damage. I think, we have potential medications in the future for dry geographic atrophy, which is very exciting as well. So I think just, kind of advance their technology, applying that to the retina. I think that's what we're hoping to achieve is kind of, again, more durability, potential of different mechanisms of action treatments to help patients with these conditions. And you never know. I hope one day we're able to devise a potential of a cure. I think that's hopefully the aspiration of everybody. But I think, at least for now, we're hoping for just, more enhanced treatments, better patient satisfaction with this condition, and the ability to just, again, give patients the best possible vision for as long as possible to, again, to live their life. And I think that's the most important thing. Again, at the end of the day, I always ask my patients, what they like to do, what their hobbies are, because that's important to me too. Because my goal is to try to help them see better, to do these activities, whether it's reading, driving. I have patients that do a lot of artwork, so it's precise vision with AMD is, although a challenge, but they're able to overcome that and maintain vision well enough to create the artwork. I think that's just, again, that's important for me to know that, because I can help design regimens to help to maximize that. And again, my goal is to give them the best possible vision to accomplish those things.
Yeah, it's amazing how far we've come in a relatively short period of time, but we're so poised for some major advances in things that I've been talking about for 2 decades. You touched on gene therapy here and some of the new vector delivery systems, and you touched a little bit on dry advanced macular degeneration with those atrophic changes where stem cells or other approaches may play a role. And then the other thing I think is that we're still seeing major advances also in sort of our ability to functionally improve the activities of our patients. Because you and I, doesn't matter what you read in the room, it matters what the world is like for you outside. So there have been some discussions about new goggles using AI interfaces to allow scotomas to be reduced. I think it's kind of amazing where we're going. I think that the pandemic slowed us all down a little bit in terms of some of those research activities, but I think you're going to see a real push forward over the next several years. So I'm excited about that also.
Absolutely, and for me, I'm just honored to be the Retina medical director of the Macular Degeneration Association to provide education, research and advocacy for patients, and again, give them that hope and let them know that knowledge is power. And I think that once they kind of aspire that and achieve that knowledge, I mean, they can do anything. And I think this disease will be another disease that can be managed. And I think that having that sort of inspiration and hope is probably the key motivation factor that I want to give patients, and I'm able to do that through this organization.
Well, I love how passionate you are, and one of the things that I see, from our colleagues across the board is that, you have brilliant physicians, but they're truly passionate about taking care of their patients and really giving them the best. And so thank you for spending time with us to talk about the Macular Degeneration Association. Thank you for being the doctor that you are. And we look forward to maybe talking to you again as we see some of the advances we discussed going forward. So Dr. Joshua Mallon from Sarasota, Florida, thank you so much. It's been a pleasure.
Pleasure's mine. Thank you so much. Thanks for having me.
Thanks for tuning in to Retina Health for Life from the President's Corner. You can watch and listen to more episodes on the ASRS YouTube channel and on popular podcast directories, including Apple Podcast, Google Podcast, and Spotify. For even more information about safeguarding your vision for a lifetime, visit asrs.org/patients and follow ASRS on both Facebook and Twitter. Retina Health for Life is made possible in part through generous support from the Foundation of the American Society of Retina Specialists, Allergan, Genentech, Novartis, and Regeneron Pharmaceuticals. See you soon.